Now students, coming to the second lecture in this General Pharmacology, here we have to understand the main concept of essential medicines. Now, what is this concept of essential medicines? The concept of essential medicines says that drugs or essential medicines are those drugs which satisfy the priority healthcare needs of the population. So in a population, when there are so many people, then which medicine will be constituted or will be selected as an essential medicine? This is what we have to understand. So the drug is selected with regard to the, first of all, public health relevance, कि whether it is even relevant or not, like it is usable or not, public में वो disease है भी कि नहीं कि हम उसे use कर सकें. Then based on its evidence of its safety, whether the drug is safe or not safe, and efficacy, whether it is efficacious or not. Agar if it's not efficacious, if it is a toxic drug, then definitely it will not be selected as an essential medicine. The third point is, and that is the major point, is cost effectiveness. So whether the drug is cost effective or not. So essential medicine, again I'll say, it is something which should be available in the system at all the time, right? It should be available in adequate amount. ऐसा नहीं कि if there is a problem and more drug is needed, then it is not present. It should be available in appropriate dosage form. Like, what is the dosage form? It is the form in which the drug is given. So you want a drug in tablet and it is available in injection, so it is not going to be useful. And it should be available with adequate information, like, you know, it should not be something very rare kind of drug कि उसके बारे में पता ही नहीं है. And the fifth thing is that the price should be affordable for the patient and the community as well, for the patient and the community as a whole, right? So then only when these criteria are fulfilled, then a drug can be called as, then we are selected as an essential medicine. Okay, now WHO brought out its first essential medicine list. So the first essential medicine list was brought out in 1977. After that, it has been revised from time to time. So here from WHO, we have the latest list 2021 mein, that is the 22nd list, and that has got 439 entries, which includes 41 FDCs. This is WHO. What about India? So India has released its own essential medicine list, and it was first released in 1996. It was called as National Essential Drug List. Okay, and it was revised in 2011. Then in 2015, and that time it was called as National List of Essential Medicines. And the latest one was brought out in 2022. And here, this 2022 latest list has got 384 medicines or 384 entries, and which includes 23 FDCs, right? So these medicines, now they are available at all centers, that is primary, then secondary and tertiary centers, right? And these drugs under the rural and urban health missions, they are being provided free of cost at the various public health facilities also. So that is what is the main important thing of essential medicines, that chunki for poor patients even a single money is not affordable, so these medicines can be given free of cost also to the patients, right? So because of the adoption, because of the essential medicine list के advantages क्या होते हैं, like suppose they ask you like why this concept is made, what is the need of this particular list. So the first thing that is beneficial, the first thing is that the patient gets the medicine, you know, the medicine availability to the patient increases. You can say there is an increase in the availability factor, so which is very, very important. Second, it is cost saving, so it is not very costly for the patient. And third thing is that there is more rational use of drug. So the drugs can be used more rationally, right? So this was about essential. Now from this rational use of drug, let's come to the second concept that we have to study. Let's come to the concept of rational use of drugs. Now rational use of drugs basically is defined as the process. It is the process of appropriate prescribing and dispensing of drugs, right? Now this is done for the there are many rights here. So right patient, this is done for right patient. The patient should be given right drug, right route, right time, and in right dose. So when you fulfill all these rights, then it is called as rational use of drugs. So basically, rational use of drugs, also called as RDU, it means that the patient receives medications. So the patient receives the medication or receives the drug that fulfills or treats or is as per his clinical requirement, जो उसकी clinical need है उसके हिसाब से है. Then it is given in dose that is basically correct and meets the individual requirement, right? Then next, it is basically given for an adequate period of time. That means it is not given either less or more. So adequate period of time, that is right time, and at the lowest possible cost to the patient and to the community. So this is basically called as RDU or rational use of drug, where the drug is given as per the clinical needs in doses which is correct and meets the individual requirement for an adequate period of time and at the lowest possible cost. So what is the benefit or what is the advantage of RDU? What is the RDU क्यों है, इससे क्या फायदा होगा? So सबसे पहला फायदा जो पेशेंट को होता है, the first benefit is the cost is reduced. So then, when you are giving a drug rationally to the patient, then you're automatically seeing that you don't give a costly medicine. You give a medicine which the patient can afford. Then you don't give it for a long period, don't give for prolonged period. And what happens when you don't give for a prolonged period? Then you are able to reduce the adverse effects, because when you're not giving a drug for a long period, then automatically the adverse effects are being reduced. There is a reduction in the drug interactions. And the fourth and most important point is there is an increased quality of healthcare. So this is something which we get when we use the drugs rationally, and so this concept of rational use of drugs is being applied everywhere.